Let's discuss gastric and duodenal ulcers as we continue with face reading. This disease results from the decreased protective function of the local mucosa of the stomach and duodenum, leading to its failure to balance the acidic gastric juices that aid digestion. Clinically, the disease features a chronic process, periodic attacks, and rhythmicity of symptoms. The main symptoms are upper abdominal pain, nausea, vomiting, acid reflux, salivating, abdominal fullness, and constipation. Triggers include mood swings, unhealthy lifestyle habits, and side effects from drugs. Now let's go to face reading. Reticular hyperplasia of the lower eyelid conjunctiva and bulbar conjunctival blood vessels suggest pathological changes in the stomach and duodenum. Patients with gastric ulcers often have a thick yellow tongue coating and a red tongue texture, while those with duodenum ulcers mostly have a smooth tongue surface with no coating, or a thin layer of white coating and the tongue is light or light red. Here is a picture showing reticular hyperplasia of the lower eyelid conjunctiva and bulbar conjunctival blood vessels. For the therapeutic method, the patient should consume a regular diet, avoid overeating, refrain from food that are too sweet, too sour, too salty, and too hot, and foods that are raw, cold, hard, spicy, or pungent, because such food tend to irritate the stomach. Eat more easily digestible food. Here is an illustration showing a tongue with a thick yellow coating and a red texture. For massage, press mid the hook point or the LI4 point with your thumb for 3 minutes, 3 times a day. Freeze knead until a distension is produced. This point is effective for diseases of the digestive system. Frequent massaging of this point can clear away heat and eliminate fire and effectively relieve the symptoms of gastric and duodenal ulcers. Thank you for your attention.
Interviewing, still on menstruation. Inquiry into the menstrual cycle can be difficult. Some women are very precise and know the regularity of the bleeding, the quality and the quantity of the blood, and so on. Other women take little interest in their cycle and sometimes even assume that you, as a therapist, know where she is in her cycle better than she does. The length of the menstrual cycle is affected by many different imbalances. Spleen Qi deficiency, kidney Qi deficiency, and heat can make the cycle shorter. Heat will agitate blood, so the walls of the vessels rupture, whilst spleen Qi deficiency will not hold blood inside the vessels. The kidney Qi deficiency can result in the kidney failing to hold the uterus closed, so the bleeding comes earlier. If there is too little blood to create a menstrual bleeding, or if anything blocks blood, such as cold, blood stagnation, or Qi stagnation, the menstrual bleeding will be delayed. Liver Qi stagnation can cause the length of the cycle to be irregular. A woman should menstruate approximately 45 ml of blood during the menstrual bleeding. Many women have difficulty judging whether they have normal bleeding, as they only have experience of their own bleeding, and using tampon makes it difficult to gauge the amount of blood discharged. Asking about how often they have to change their tampon or pad and which type of pad or tampon they use can give an indication of the heaviness of the bleeding. Many women also have a reasonably good idea of the amount of blood there is, especially if they have heavy or scanty bleeding. Heavy menstrual bleeding can be seen when there is either heat or spleen Qi deficiency due to the mechanisms explained above. Blood stagnation can block the vessels in the uterus, causing them to rupture. This too results in heavy bleeding. Scanty bleeding is due to blood deficiency, cold, or blood stagnation blocking the flow of blood. Menstrual bleeding lasts longer than 5 days. Spotting before the menstrual bleeding and bleeding in the middle of the cycle are all signs of spleen Qi deficiency, resulting in blood not being held in the vessels. They can also be signs that heat is agitating the blood and rupturing the vessels, or that there is blood stagnation, creating a buildup of pressure so that the walls of the vessels burst. Inquiring about the quality of the menstrual blood is crucial. Again, some women can have difficulty answering this question, having seen only their menstrual blood. Describing the differences between the various colors and qualities can be useful. Pale, watery, or thin blood can be seen when there is blood deficiency and Qi deficiency. Very dark, clotted blood is seen when there is blood stagnation. Qi stagnation will manifest with smaller clots, whilst cold stagnation can result in very small, grainy clots that resemble coffee grounds. If there is a kidney deficiency condition, the blood may contain thin threads, and if there is damp phlegm, the blood will contain mucus. Bright red colored blood is seen when there is heat. Heat can also result in the menstrual blood being sticky. Brown colored blood can be seen when there are blood deficient conditions. Blood stagnation causes the blood to be very dark in color. If there is a lot of blood stagnation, the blood will also be almost black. The presence of menstrual pain is quality, and when it occurs, are important differential factors when determining which patterns of imbalance are present. Pain that starts prior to the menstrual bleeding is seen when there is liver Qi stagnation. Liver Qi stagnation pain is generally characterized by coming in waves and varying in its intensity. The word many women use for this is cramping. The pain can be located in front and on both sides of the lower abdomen. It can also cause soreness or pain in the lower back and may radiate down the inside of the thigh. This is because liver Qi stagnation will stagnate Qi and blood in Chong Mai. Thank you for your attention. Acupuncture Qi flow and points measurement. The paired meridians. Qi is energy equivalent that runs through the acupuncture points of the body. These acupuncture points are used for gathering, exporting, and converting the Qi flow. Stimulation of the points can facilitate Qi circulation, balance the yin and yang, and promote health in the body. This chapter will discuss these points in relation to one another, the meridians, and the methods of measurement employed to locate them on the body. There are more than 360 identifiable acupuncture points which are connected along 14 principal meridians. There are 12 paired and 2 unpaired meridians. The lung, large intestine, stomach, spleen, heart, small intestine, large intestine, kidney, pericardium, triple energizer, gallbladder, and liver are the 12 paired principal meridians. The unpaired meridians are Ren and Dumai. The Qi circulates through all 12 paired meridians every 24 hours. Therefore, a period of 2 hours is the maximum circulation for each individual meridian. This begins with the lung meridian at 3 a.m. The large intestine, stomach, and spleen meridians follow for the Taiyin and Yangmin couplets. The Shouyin and Taiyin couplets begin at 11 a.m., which include the heart, small intestine, bladder, and kidney meridians. The Junyin and Shouyang couplets begin at 7 p.m. with the Qi circulating through the pericardium, triple energy, gallbladder, and liver meridians. Here we see the Qi circulating throughout all 12 meridians every 24 hours. So we start at the Taiyin, which is the lung at 3 to 5 a.m., following the large intestines at 5 to 7 a.m., and then the stomach at 7 to 9 a.m., then the spleen back to Taiyin at 9 to 11 a.m. And it goes to the Shaoyin meridians, which is the heart at 11 to 1. Then it moves to the Taiyang, which is the small intestine at 1 to 3 p.m., down to the bladder at 3 to 5 p.m., then moves back to the Shaoyin at kidney, kidney meridian at 5 to 7 p.m. Next would be the pericardium at 7 to 9, the triple energy at 9 to 11 p.m., then down to the gallbladder at 11 to 7 a.m., and to the liver at 1 to 3 a.m., and back to the lungs at 3 to 5 a.m. Commonly, yang meridians flow through lateral part of the body, and yin meridians run through the medial part of body. The body is also divided into anterior, middle, and posterior. Yang Ming and Tai Yin are in the anterior, while Xiao Yang and Jun Yin are in the middle, and Tai Yang and Xiao Yin are located in the posterior. As shown here, the orientation in the drawing and as discussed above. Thank you for your attention.
Let's discuss differential diagnosis, Western and Chinese medicine, the infertility. In women, number one, stemming from endometriosis, with increasingly painful periods, pelvic cramps, clotted blood, lower backache, painful sexual intercourse, painful bowel movements. Number two, stemming from ovulation dysfunction. Letter A, polycystic ovarian syndrome with abnormal menstruation, menorrhea, weight gain, obesity, insulin-resistant diabetes, infertility, hirsutism, increased breast size, and acne. Letter B, hyperthyroidism with weight loss, increased appetite, diarrhea, restlessness, menstrual irregularities, goiter. Letter C, hypothyroidism with weakness, fatigue, cold intolerance, weight gain, depression, joint muscle pain, thin brittle hair, brittle fingernails. Number three, stemming from ovarian cyst with pelvic pain or at period, painful sexual intercourse, abnormal uterine bleeding, abdominal bloating, or distension. Number four, stemming from damage to or blockage of fallopian tubes. Letter A, chlamydia with vaginal discharge, burning urination, painful sexual intercourse, rectal pain, discharge. Letter B, gonorrhea with vaginal discharge, frequent painful urination, lower abdominal pain, fever. Number five, stemming from cancer. Letter A, uterine with abnormal uterine bleeding, abnormal periods, very long, heavy, frequent episodes of bleeding, pelvic cramping with thin, white, clear vaginal discharge in post-menopausal women. Letter B, ovarian with abnormal bleeding between periods, persistent vaginal discharge, bleeding after intercourse, loss of appetite, weight loss, fatigue, pelvic pain. Number six, other causes include scarring from sexually transmitted disease, poor nutrition, hormone imbalance, emotional problems. For the diagnostic questioning, according to first the organ interrelationship. Primary case cycle, Shaoyin, fire and water, in arena of uterus. Number two, 8 principles, excess obstructed uterus, Ren Chong vessels by pathogen. Example, cold, heat, dampness, phlegm, Qi stagnation, blood stasis. Deficiency, Qi, Yang, Yin, essence. Number three, ovulation, menstruation, problematic ovulation or start of cycle, most commonly kidney yin deficiency. Next, most commonly stagnation of heart Qi, either complicated by stagnation of liver Qi, phlegm dump, liver blood stasis, problematic embryo implantation, IVF, or second part of cycle, most commonly kidney yin deficiency, may be complicated by stagnation of liver Qi, phlegm, dump, liver blood stasis, kidney yang deficiency with spleen Qi deficiency. Number four, presenting condition, endometriosis, kidney yang deficiency with liver blood stasis. irregular ovulation, kidney yin-yang deficiency. PCOS, kidney yang deficiency with stagnation of phlegm, dump, and possible blood stasis. Tubal blockage, stagnation of qi and blood. PID, salpingitis, endometriosis, damp heat in the lower burner. Number 5 most common patterns, liver blood stasis, kidney yang deficiency, spleen kidney yang deficiency, liver kidney yin deficiency. Number 6, Sangpu patterns for the excess, stagnation of heart qi, stagnation of liver qi, liver blood stasis, phlegm dump. For deficiency, liver yin deficiency, kidney essence, yin deficiency, kidney yang deficiency, kidney yin and yang deficiency, spleen qi deficiency. Thank you for your attention.
Relationship between spleen and stomach. The spleen and the stomach are both located in the middle jaw. They are linked in an interior-exterior dyad by meridians. There are 3 aspects to this relationship. First, digestion, transportation, and transformation. The stomach governs the receiving and digesting of food and drink into chyme, and in so doing provides the material for the spleen to transform and transport. The spleen transforms and distributes the essential substances to the entire body, and the nutrients enable the stomach to receive and digest. These 2 organs' functions must work in concert if the digestion of food and drink and the extraction and transportation of essential nutrients from them are to be accomplished. If the stomach cannot receive, the spleen cannot transform and transport. And if the spleen fails to transform and transport, the stomach cannot receive properly. Thus, pathologically, they affect each other, and their clinical symptoms generally also appear together, such as abdominal distension, loss of appetite, eructation, and loose feces. Second, raising and lowering. The spleen governs raising. It raises clear yang qi and essential substances and distributes them to the heart and the lung. Stomach qi governs lowering. It sends chyme down into the small intestine. If the spleen can raise and the stomach can lower, then qi moves smoothly and ensures normal digestion. If the spleen does not raise the clear, then the stomach does not lower the turbid, and vice versa. Clinically, abnormality of raising and lowering manifests as nausea, vomiting, abdominal distension, and diarrhea. Third, dryness and dampness. As a Zhang organ, the spleen belongs to yin. It likes dryness and dislikes dampness. As a Fu organ, the stomach belongs to yang. It likes moistness and dislikes dryness. Only when the spleen and the stomach cooperate can dryness and dampness be adjusted and the yin and yang of the spleen and the stomach be balanced. Only then can the digestive functions be maintained at a high level. Invasion of the spleen by external dampness and deficiency of spleen yang can both cause disruption of the functions of the spleen and the stomach. Invasion of the stomach by dryness heat evils and deficiency of stomach yin can cause both dryness heat in the interior. These 2 can disrupt the functions of both the spleen and the stomach. Thank you for your attention.
Let's proceed to diagnosis according to Zhangfu organ patterns with kidney qi deficiency. Kidney qi deficiency is similar in many ways to kidney yang deficiency because kidney qi is an aspect of kidney yang. When there is kidney qi deficiency, there are symptoms that are specifically relate to the functions of kidney qi, such as control of the lower orifices in the body and raising qi in the lower jaw. There will be fewer signs of deficiency code in this pattern. Now let's go to its etiology. In men, kidney qi is weakened by too much sex, and in women, it is weakened by giving birth and menstruation. Furthermore, hard physical work also weakens kidney qi. Like other kidney patterns of imbalance, kidney qi deficiency is also a result of the aging process. Now let's go to the signs and symptoms. There will be sore, weak, or cold lumbar region, sore, weak, or cold knees, an aversion to cold limbs, frequent urination, clear and copious urine, nocturia or enuresis, weak flow of urine, post-urination dripping, incontinence, watery or white vaginal discharge, nocturnal emissions, premature ejaculation, recurrent miscarriages, uterine prolapse, distension in the lower jaw, mental and physical fatigue, slow and languid body movements, poor posture, pale tongue, deep and weak pulse in the chair positions. Key symptoms, there will be weak stream of urine, post-urination dripping, watery or whitish vaginal discharge, and a sore lower back. For the treatment principle, stabilize and tonify kidney Qi and raise kidney Yang. The acupuncture points to choose from are REN 4, REN 6, DO 4, DO 20, kidney 3, kidney 7, kidney 13, bladder 23, and bladder 32. We use the tonifying needle technique, and moxa is also recommended and is necessary on REN 6 and DO 20. To further explain the choice of points, bladder 23, DO 4, REN 4, kidney 3, and kidney 7, tonify kidney Qi. Kidney 13 and bladder 32 stabilize kidney Qi and the urinary bladder. REN 6 and DO 20 raise Yang. Men should avoid ejaculating and women should avoid becoming pregnant. The patient should avoid lifting heavy objects and working too hard or placing a physical strain on the body. They should eat a diet that strengthens kidney Yang. Kidney Qi deficiency can be caused by spleen Yang deficiency and kidney Yang deficiency. In turn, this can result to kidney Yang deficiency. To summarize, kidney Qi deficiency has its etiology in emotional strain. This includes fear, shock, anxiety, and also excessive sexual activity, chronic illness, old age, and overwork. Its underlying or accompanying pathologies are heart Qi deficiencies, liver Qi deficiency, spleen Qi deficiency, before heaven Qi deficiency. Signs and symptoms, diminished hearing, dizziness, tinnitus, backache, weak back, weak knees, lack of strength, deafness, heel pain, loose teeth, hair loss, premature ejaculation, vaginal discharge, flooding, spotting, frequent urination, and urination at night. The pulse is weak on the right rear position, and the tongue is slightly pale. Treatment principle, supplement kidney Qi. For the acupuncture treatment, use bladder 23 to supplement the kidneys, REN 4 to supplement kidney essence, REN 6 to supplement the original Qi, stomach 36 to supplement the stomach and spleen Qi, DO 4 to supplement kidney Yang, kidney 6 to supplement kidney Yin, kidney 7 to benefit the kidney, and kidney 3 to nourish Yin to root Yang. We needle with supplementation the following points. For dizziness, DO 20, DO 16, and GB 39. For deafness, Sanjiao 17, GB 2, SI 19. For sore and weak back, DO 3, bladder 40, and GB 34. For vaginal discharge, GB 26, bladder 30, and spleen 6. Thank you for your attention.
Let's discuss mechanisms of pathological change, imbalance of yin and yang, yin or yang excess. The relationship between yin and yang is complex. In addition to mutual opposition and restraint, there is also mutual dependence and support. Moreover, under certain conditions, one can transform into the other. For the body to remain in a normal physiological state, it is necessary for yin and yang to be in dynamic equilibrium. In the course of an illness, various processes can disturb the normal dynamic equilibrium between yin and yang. This can lead to relative excess or deficiency of yin or yang, inability of one to restrain the other, mutual injury to both, mutual repellency or depletion. This is paralleled by disharmony among the functions of the Sangfu viscera and the meridians among the actions of Qi and blood, and between the ascent-descent and entering, exiting of Qi. The main patterns of imbalance of yin and yang are as follows. First, yin or yang excess. Excess of either yin or yang is a case of excess evil Qi becomes strength. When a pathogenic evil invades the human body, it seeks out its kind. That is, a yang evil seeks out and augments yang Qi of the body, making yang excessive, whereas yin evil seeks out and augments yin Qi of the body, making yin excessive. Thus, the plain question states excess of yang leads to heat and excess of yin leads to cold. This clearly points out the pathological mechanism of yang or yin excess and its characteristic clinical manifestation as strength cold or strength heat. Excess of yang. Yang excess is pathological state in which yang qi is excessive. The body's functions are overly active, metabolism is accelerated, the person is overly excitable, and there is excess heat. In general, this pathological state is characteristic of illness of strength heat with excess yang but not deficient yin. Four main types of situation lead to such yang excess diseases. They may be due to invasion of external pathogenic evils of yang type or by external evils of yin type, which upon entering the body becomes transformed into yang. They may result from internal injury by the five passions or by stagnation of qi, stasis of blood, or retention of food. This can all transform into fire when extreme. The dictum, if yang is excessive, there is heat, indicates that the pathological change of transformation into heat or fire is very common in an illness of yang excess, so that such a state frequently presents as an illness of strength heat. This because yang has the characteristic of warm, motion, and dryness. A condition of yang excess easily produces symptoms of heat, such as high fever, flushing of face, inflamed eyes. This is known as yang excess leads to heat in the exterior. Moreover, long-standing yang excess necessarily consumes yin fluids. This leads to insufficiency of body fluids and reduction of yin essence, which will also transform into strength heat and yin essence deficiency. This is known as ascendancy of yang leads to yin illness. Next, excess of yin. Yin excess is a pathological state in which yin qi is excessive. The body's functions are hypoactive, metabolism is depressed, and the person is overly passive. There is insufficient generation of warmth, and there is accumulation of products of pathological changes. In general, this pathological state is characteristic to illnesses of strength cold with excess yin but not deficient yang. Three main types of situation lead to such yin excess illness. There may be attack by yin type of external pathogenic evil, cold or dampness. There may be overeating of raw and cold food and drinks, which produces excess yin. The coldness bottles up internal yang and depresses the ability of yang qi to produce the necessary warmth. There may be a chronic deficiency of yang qi so that the body is unable to warm and transform yin fluids. This leads to strength of internal yin cold. The first two condition of strength, whereas the last is a mixed condition of strength and deficiency. The dictum, if yin is excessive, there is cold, indicates that this type of excessive yin is likely to lead to a depression of the functions of the viscera and tissues and the warming and transformation action of qi. As a result, there are excessive yin cold internally, sluggish blood circulation and retention of phlegm, dampness, and fluids. This is because yin has the characteristics of coldness, quietude, and dampness. A condition of yin excess easily produces symptoms of cold, such as cold torso and limbs, a pale tongue, abdominal pain, diarrhea, edema, and phlegm and rheum. This is known as yin excess leads to coldness in the interior. Moreover, long-standing yin excess necessarily induces yang qi. Hence, the transformation of yin excess to strength cold is often accompanied by a general depression of physiological activities or debilitation, effects of yang deficiency. This is known as ascendancy of yin leads to yang illness. Thank you for your attention.
Enuresis and incontinence pathology. The pathology of enuresis and incontinence is characterized by deficiency in the majority of cases. This may be a deficiency of the lung, spleen, or kidneys. Lung qi communicates downwards with the bladder, and the lungs, which govern qi in general, also provide qi to the bladder to control urine. Thus, deficient lung qi is unable to control the bladder, and urine leaks out. Spleen qi raises qi in general, and a sinking spleen qi may be unable to control urine, which leaks out. The kidneys obviously control urination directly, as the balance of kidney yang and kidney yin influences urination, and also because kidney yang provides qi to the bladder to control and transform urine. Moreover, the kidneys control the two lower orifices, one of which is the urethra. Therefore, when there is sinking of qi in urinary problems, it involves also sinking of kidney qi, in addition to sinking of spleen qi. There are, however, some full types of enuresis. An example of this is in some children in whom nocturnal enuresis is due not to a deficiency, but to liver fire infusing downwards to the bladder. These tend to be tense and highly strung children. Some modern Chinese doctors, in fact, think that the pathology of enuresis in modern children is different from the old times. They say that in the old times, children's constitution was often weak due to poor diet, and that enuresis was mostly due to the child's poor constitution. In modern children, the constitution is better than in the past due to improved living conditions and diet. They therefore think that enuresis is often due to heat and phlegm in the heart from a nervous disposition. The Chinese disease entities of enuresis and incontinence must be distinguished from that of urinary syndrome or LIN. As a symptom, incontinence is often a feature of urinary syndrome, but this latter disease is always characterized by a difficulty on urination and often pain. By contrast, in incontinence as a disease, there is neither difficulty nor pain. To summarize, the pathology of enuresis and incontinence is always characterized by deficiency of the lungs, spleen, or kidneys. When there is sinking of qi in urinary problems, it involves also sinking of kidney qi in addition to sinking of spleen qi. There are full types of enuresis. Liver fire infusing downwards to the bladder is an example. The Chinese disease entities of enuresis and incontinence must be distinguished from that of urinary syndrome of Lin. As a symptom, incontinence is often a feature of urinary syndrome, but this latter disease is always characterized by a difficulty on urination and often pain. By contrast, in incontinence as a disease, there is neither difficulty nor pain. Thank you for listening.